5 things you must know before having surgery after age 70 for a smoother recovery and to avoid complications. If you or a loved one, a parent, grandparent, or even a close friend, is preparing for a major medical procedure, this video is a must-watch. Aging comes with its own set of challenges, especially when facing surgery. But with the right knowledge and preparation, the journey to recovery can be safer, faster, and more comfortable. Let's walk through this together, gently and clearly. Why is surgery after age 70 different? As we grow older, our bodies go through many changes. The heart, lungs, and kidneys may not function as efficiently. Muscle mass decreases, bones become more fragile, the immune system weakens. Even how the body processes medication changes. That's why older adults are more vulnerable to surgical stress, anesthesia, and possible complications like infections, bleeding, or post-surgery confusion. But here's the good news. Many people in their 70s and even 80s have successful surgeries and return to active, fulfilling lives. The key is thorough preparation and strong support. Get a complete health evaluation. This is more than just checking blood pressure or glucose levels. We're talking about a full picture of your health. Make sure to assess heart function with an EKG or echocardiogram lung capacity, especially if there's a history of asthma or COPD kidneys and liver, through blood and urine tests, cognitive and emotional health, to check for risks like delirium or depression medications, to catch any dangerous drug interactions. Why this matters. Many complications stem from pre-existing conditions that go unnoticed. For instance, unstable blood pressure or mild kidney issues can become serious if not addressed early. Tips for families. Request a comprehensive pre-op screening from the doctor. Bring all medical records and medication lists. Involve other specialists, cardiologist, pulmonologist, or geriatrician when needed. Real story: Mrs. Ratner, age 72, was scheduled for back surgery. Luckily, during a thorough checkup, her doctor found an irregular heartbeat. The surgery was delayed for a few weeks for treatment, and it was safely performed later with no complications. Improve nutrition before surgery. This might sound simple, but it's incredibly powerful. Many older adults have hidden malnutrition. They look fine, but have low protein or vitamin levels. Why nutrition matters. Protein helps tissue healing. Vitamins and minerals boost the immune system. Good nutrition reduces infection risk and speeds up recovery. What you can do: get a nutrition assessment from a dietitian. Focus on protein-rich foods. Fish, eggs, tofu. Temper had senior-friendly supplements if needed. Stay hydrated. At least 1.5 liters per day, unless fluid intake is restricted. Important. Adjust nutrition plans based on existing medical conditions. For example, limit protein if there's kidney disease. Understand anesthesia and its impact on seniors. This is a major factor that often gets overlooked. Many complications after surgery come from anesthesia, not the surgery itself. Common types of anesthesia. General anesthesia. You're fully unconscious. Regional anesthesia. Spinal epidural. Numbs part of the body. Local anesthesia. Small area, used for minor procedures. Potential issues in older adults. Post-op confusion, or delirium, temporary memory loss, or disorientation. Longer-lasting side effects from the medication. What you can do: have a direct conversation with the anesthesiologist. Share all medical conditions and medications. Request close monitoring during and after the procedure case study. In a hospital in Singapore, nearly 40% of patients over 70 experienced confusion after general anesthesia. But when spinal or regional anesthesia was used more often, the rate dropped to just 10%. 4. Care for mental and emotional health surgery can be scary, especially for older adults. It's not uncommon for them to feel nervous, anxious, or even depressed in the days before surgery. Signs of anxiety, trouble sleeping, repeating the same questions, withdrawing from conversations. How families can help: be honest but gentle. Explain procedures in simple terms. Involve them in decision-making. Ask how they're feeling. Really listen. If needed, consult with a hospital counselor or psychologist. Relaxation ideas. Deep breathing exercises before bed calming. Music bring comforting items to the hospital. Family photos, prayer books, etc. Insight from a psychologist. An older adult's mental state significantly affects their recovery. Patients who feel calm and supported by their families tend to heal faster and have fewer complications. Dr. Lisa Indrawati, Clinical Psychologist 5. Have a clear recovery plan. Don't wait until you're back home to ask, now what? Plan recovery steps ahead of time. Here's what to think about. Hospital stay duration. Ask your doctor for an estimate mobility aids. Will they need a walker, cane, or wheelchair? Physical therapy. When to start, how often, and with whom medications and follow-ups. Make a checklist. Daily care. Who will be there 24/7? Make your home recovery ready. Install grab bars in the bathroom. Remove rugs or hazards that can cause falls. Lower the bed if needed. Ensure good lighting, especially at night. Real example. Mr. Damo's family hired a caregiver for a month, adjusted his bed and scheduled regular physical therapy after his hip surgery. Within 6 weeks, he was walking with a cane, independently. Let's recap. Before having surgery at age 70 and above, remember these 5 essential steps. Get a full medical evaluation. Improve nutrition and hydration. Understand anesthesia and its risks. Support mental and emotional well-being plan for post-op recovery and detail aging does not mean we have to fear surgery. With preparation, family support, and guidance from healthcare professionals, recovery is not just possible. It can be successful. And most importantly, you are not alone. Let your loved ones, doctors, nurses, and caregivers be your team. They're here to help you walk through this journey with strength and peace of mind. If you found this video helpful, please give it a like. Subscribe to our channel and click the bell so you won't miss out on important updates about senior health. Share your thoughts in the comments. Have you or someone you love gone through surgery at an older age? What helped the most? Let us know, and we may feature your story in a future video. Thank you so much for watching. We wish you and your family health, happiness, and the strength to face life's challenges with courage and hope. See you in the next video.